I think we need to work on two different tracks, which, they kind of converge and diverge, so I would say, bedside, bench to bedside research, right? Understanding the fundamental mechanisms. I think we know a lot about A beta and tau. We don't know as much as about the hormones, about the blood vessels' influence on dementia and cognition. We need to kind of beef up that. And then getting the information we derive from these studies and try to apply to patients. For example, biomarkers of disease. Okay, once you identify early indicators of disease, you can then go back to the patient and test that's really happening. And then you can go back to, once you have established that this is relevant to humans, you can go back to the mouse or whatever and test the possibility, therapeutic approaches by interfering with those pathways. So there should be a strong kind of bidirectional link between the bench and the bedside. Now, what we do now, we find something at the in the bench, new thing and whatever, and you immediately go to the clinical trial. And most of those have failed because we have not really done our homework to go back to the mouse. I'll give you an example. For example, the beta antibodies, immunotherapy of Alzheimer's disease, in which antibodies are given to remediate the plaques. Well, it turns out that many of these antibodies, particularly the most effective ones, they also alter blood vessels of the brain by causing this ARIA syndrome, this edema around the blood vessels, which is due to the fact that A beta is released from the plaques. Great, all right? But then it gets the blood vessels to get removed, and it causes vascular problems, all right? So that's an example of this. And now, they got to watch for it. It's not a big, clinically, it's not a big deal in terms of, the patient may have a little bit of a headache, but you don't know, in the long run, what's going to happen. Now people is in the clinical trials, you have patients who are monitored, very, very closely, and they stop things right away and so on. But if you give this as a drug, you may have a big problem in your hand. So we got to understand that better, the way these factors work. Going back to the mouse or to the monkey, for example, there is a big push now to develop to use the marmoset. There is transgenic marmosets available, and at the University of Pittsburgh, they have made marmoset that have the presenilin mutation. It's not published yet. So then we can look at this, when they are children, when they were children, very, very little, and see what happens, over time and when things really start to happen. And if you can, most importantly, to see if you can treat them. And see if you can reverse some of the effects early on, as opposed to waiting until they're symptomatic when it may be too late. So I think this bedside to bench and vice versa which is very well done in cancer, by the way. There is a lot of this stuff in cancer where they find certain cells or certain things. They go back to the patient, to the animal, and they test those cells. So then using iPS cells or new technologies to study in vitro models, for example, and then go back to the patient once you have refined your approach. The key to dementia is going to be multidisciplinary approaches. It's not all tau and A beta. There are multiple pathologies. Some of these have to do with the vascular risk factors. Some of these have to do with other neurodegenerative. For example, alpha-synuclein is present in about 10 to 20% of brains in patients with Alzheimer's. TDP-43, there are a number of other factors there. And so, although the focus on A beta and tau is well justified because that's where the farther we are in terms of understanding, I think once we move to the patient, we got to be a little bit more open, and this will require a complete reshuffling of the clinical trial model, and then how are we going to move this stuff into the community, which is probably one of the biggest challenges we have. Think about the vaccine, the vaccine for COVID. In an acute setting, how complex the process has been. And if there is no life-threatening situation, how well are we going to do? Are we going to be as proficient, or are we going to take us longer, and so on? So, trial clinical trial to community, the fourth phase, it's called, of this translation, is going to be a major, major hurdle.